Thank you, Premier. This is certainly a difficult day, and these recommendations and the advice that I've given to Cabinet this morning are certainly difficult decisions and recommendations to make, but they are necessary. And my advice is not in response to any single event. It's in response to a number of things that are showing that we are at the brink and we need to step back from the brink, that we are maybe just keeping up with this outbreak, but we are not ahead of it in the way that we need to be in order to achieve control. It's certainly in response to continued daily cases in their 20s, the newly emergent mystery cases, and we're now getting them every day. They are a particular challenge because they generate exposure sites, people who've just been diagnosed but have been out in the community for essential reasons or for permitted work reasons, have therefore exposed a number of others. We need to chase down every single one of those contacts and the hundreds and hundreds of secondary close contacts that get generated, and all of those exposure sites become a risk for people across metropolitan Melbourne and potentially beyond. We absolutely need to do more to address those gatherings that we have seen and spoken of this morning that might individually look like lower risk events. They might look like they won't be a driver of transmission, but collectively they are part of the really substantial challenge that we're facing in having additional cases each and every day. We take all of those elements together as a whole, and these additional measures are also taken as a whole. They are a suite of measures that we know need to work in concert to be able to drive cases back down. And it has always been the case that it's not just the policy elements, it is not just the communications or engagement, it's not just the compliance and enforcement, it is the work of all Victorians together that has meant that we've been successful 5 times previously, including one of the most challenging and indeed one of the most successful responses to a wave in the world last year. So we know that the principles that underlie these new directions are ones that can be successful and will be successful if we all pull together and if we all recognise that we are right on the cliff edge here, but that if we can pull back from it, we can absolutely get to the finish line that we know we want to get to. That's not just getting to the 80% vaccination coverage, but before that point in time, we can also enjoy the freedoms that we've had on and off for months and months over the last 18 months. But let's not kid ourselves. There have been breaches, there have been people bending the rules that put us all at risk. And so we have to tighten those elements and we have to recommit ourselves to doing as much as we possibly can in this period of time to get to where we know we need to be. Because a grumbling few cases now is the hundreds in a fortnight or the thousands in a month. And the challenge is substantial. More cases today in Darwin, more cases in Canberra, significantly more cases in Canberra. The Delta variant is not the same challenge. It is a step-up challenge, and we need to step up to meet that challenge. We have seen transmission in workplace settings, so those tighter restrictions in the workplace where you really need that explicit permission is that check. It's that check for each and every one of us to say, am I absolutely required in a workplace setting rather than from home? So the directions will come in force at 11:59 p.m. tonight, but the permit will not be required for another 24 hours. But do the right thing and work from home if you can. But the paperwork is not required for another 24 hours. On top of the new settings that the Premier's announced, I do want to say this one key thing. This virus is infectious before you have symptoms. So wearing a mask is always important. limiting your interaction with other people is always important, because you may have no symptoms, you might be about to develop symptoms, or you may never get symptoms, but you are still infectious. But you can be particularly infectious as those symptoms begin. So each and every person should ask themselves every day, have I had minor symptoms, mild symptoms in the last few days? Have I woken up this morning with the mildest of symptoms? Just the beginnings of a runny nose, just a scratchy throat, the beginning of a cough, a headache. If you have any of those, even mildly, please get tested. That is what will uncover these chains of transmission that we haven't found. That is what allows us to get in front of this virus and all of the chains of transmission that we have done successfully when we know and have identified them. Early notification is absolutely critical. We're doing 30,000 tests per day. The system could take 40,000, 50,000 tests per day. So don't be shy about it. The waiting times are not excessive. They will change in different suburbs according to different exposure sites. But by and large, there is no waiting time that is greater than 60 minutes. If you have to drive another 20 minutes to save an hour in waiting, you can do that. For the purpose of testing, you can leave home. Of course, I'm disappointed to be here where we are, but again, I know how successful we've been. I know that the underlying principles of following these directions, of limiting our movements as hard as it is on our families, on our mental health, on all of those human needs that we have for interaction. If we don't do it now, and if we can't get ahead of it, the long, long tail of this will be even worse for us. As the Premier said, if we could choose differently, we would choose differently. But when the options are driving this down to zero and then having the freedom to see our families, our loved ones, our friends again, or to see cases spiral into their hundreds and then their thousands, we have to make this choice. As difficult as it is and as tough as an extension is right now, we can get there, and the finish line, the light at the end of the tunnel, with a time to buy, more people getting vaccinated, and to be on track for 1 million vaccinations over the next 5 weeks. These are positive developments, but we have to drive our current outbreak down now in order to buy us that time so that we can all be safe. I'll pass to the Commissioner. Thank you. I absolutely thought about it long and hard. I thought about it as a father of 3 kids who love to go to the playground, where it's one of the only escapes from home in a day. So it is not an easy choice to make, and the welfare issues are real. The fact remains, we've seen lots and lots of gatherings at playgrounds, and they're both the kids interacting in significant numbers, and they're in close proximity. That's what kids do. But also parents, many of them socially distancing, wearing masks appropriately, but a not insignificant number who'll sit right by each other, coffee in hand, mask down. That's a transmission risk. And the more we can get on top of each and every chain, whether it's a small, a moderate, or a significant contributor to that overall burden of transmission, we have to get to the finish line fast, so that this doesn't drag on and on and on, and we get even angrier and even more frustrated and even more willing to ignore what needs to occur.
But Professor, it is dragging on. And it's one of the few social outlets kids in particular have. I mean, you've also got written down here, no one's mentioned the fact that you can't have a single bubble or was it the relationship bubble too?
No, I don't believe that's the case.
After curfew, sorry.
One place to stay.
After curfew, with respect to the curfew, you can't do it to visit your single-person bubble, but you've still got single-person bubbles. So yes, there are not many outlets, and yes, it's dragged on much longer than any of us would have liked. But the prospect in Sydney at the moment is another 3 months on top of 2 months for some people in the southwest and west of Sydney. Five months. Now, Victoria didn't go 5 months. We went 4 months. That was an eternity. We do not want the prospect of this going on and on and on. And so the hard choices now for a very tough fortnight ahead is to have that outlet available to us through September, October, November and beyond.
Specifically, what consideration have you given to the fact that that's actually likely to increase crowding at places like supermarkets because people won't have the option of shopping late at night when things are quiet? And what evidence do you have that curfews actually curb transmission?
So I'm not convinced that it's going to increase attendance at supermarkets. There are lots and lots of places that you can go. We're encouraging a full shop to be done when people do it, not the small amounts that people can do too frequently. This is a message about minimising all of those trips outside of home, and for one person to do that shopping when it's required. The evidence around curfews is not dissimilar to the evidence around a whole bunch of other interventions. They are hard to tease apart from the suite of interventions that happen, but between stopping small gatherings, stopping large gatherings, density quotient, social distancing and the like, it is one of a suite of interventions that was very successful last year in Victoria. There are published studies on curfews and people are free to look at them. A lot of these things will remain in a space where it can't be definitive because they've been applied with a whole bunch of other interventions. But the curfew was part of a suite of very successful interventions. As I said, last year's second wave, to drive down from around 700 cases to zero in support of a aggressive suppression strategy was one of the most successful in the world. And I think the curfew was a part of that and was part of that success. It is in support of stay-at-home orders that say that there shouldn't be private gatherings, that there shouldn't be public gatherings, and so it absolutely reinforces that. It also makes the compliance element more straightforward. That shouldn't be dismissed. That is another part of making sure that people who are out after 9 p.m. or before 5 a.m. Are only doing so for those emergency reasons or as essential workers. It makes the job of Vic Pol easier, and I won't speak for the Commissioner, but I think that's what we've discussed, and that's part of it as well. And finally, there is a social norm that comes with this is a really serious point in time, and the curfew is reinforcing exactly how serious that stay-at-home direction is and needs to be.
How do you know the curfew lands the same way?
Does making enforcement easier justify such a huge incursion on people's freedoms?
I don't know that there is such an incursion on people's freedoms when the stay-at-home directions are actually the incursion on people's freedoms. The necessary and proportionate incursion, it is that you cannot visit another household other than for those small and accepted reasons. You cannot gather in public other than for the purpose of exercising with one other person. The curfew is not the constraint. The stay-at-home directions are the constraint, and the curfew supports that, both from a clarity of messaging point of view, but also from an enforcement point of view.
It's clearly a bit of like a shock and awe thing. So you want to, I guess, you want to get people's attention.
Look,
how much are you worried that, like, we're over it, right? People are. Do you worry that something like a curfew isn't actually going to have the same amount of impact because we've been through everything else?
Of course, I worry about everyone being over it. There's such a strong sense that we've made such sacrifices, and here we are again, facing another battle. I hope that we can be energised by the success we've had in the past and the understanding that it's absolutely possible, and getting to an aggressive suppression state, again, with no community transmission, means that we can do all of the things that we want against an awful alternative option. And it's not easy for anyone to intellectualise about, suddenly finding it easier because the alternative is catastrophic. But that's the reality.
So that last time we had a curfew, there were 700 cases, there was months of lockdown ahead of us. Is it different this time because you're hoping that maybe in 2 weeks it'll be over and we'll be able to ease restrictions?
I certainly hope that we'll be over. Primarily, it's looking at the epidemiology of the last 10 days. We called this lockdown 36 hours after the first cases were notified, the first mystery cases. It's not that we haven't acted quickly. It's not that the contact tracing hasn't been supremely effective. It's that we are still struggling with 20 cases per day. And so you're in a position where, look, if cases are creeping up because the effective reproduction number is 1.1, that's still a scenario of slow but steady exponential growth that will take us to the hundreds. If we can just tip it, and maybe this is one element that just tips it below 1, that means that we can get those numbers manageable and that those mystery cases slowly but surely go. That's a really important additional measure, if that's the difference between failing and winning.
Because we haven't seen like a doubling in cases.
No, we haven't seen doubling in cases, but I don't want us to be at 25 through September, October, November, December under stay-at-home orders, because that would be intolerable for everyone.
This is potentially going to be a very tough and potentially traumatising time for Victorians, particularly when it comes to mental health, Professor. Can you give some advice to Victorians that may need that support over this difficult fortnight?
I'm not the professional, but please reach out. Please reach out to those who can support you. Within your own family, speak to your struggles. Within your circle of friends, through the social media and correspondence that you'll have, picking up the phone, getting on a Zoom call, please reach out and speak to your struggles and ask for the support of those who can help you. And for anyone who needs professional support, please reach out. Pick up the phone, call Lifeline, call Headspace, speak to those individuals who are there to support you. I know that this is not making anything easier with respect to mental health. As I have always done, I am balancing it against the awful prospect of months and months of this, which would be catastrophic for mental health. So all I can say is what awful choices, and to impose them and to be the decision maker in that regard is a heavy burden for me. But by God, I don't want people to have to suffer this for months and months to come.
The most vulnerable members of our community have had months to get vaccinated, the oldest people and the sickest people. These lockdowns are likely to have the highest mental health impact on younger, less vulnerable members of society. How did that factor into your considerations?
Well, we've always wanted to protect those most at risk of dying at the earliest point when vaccines were available. That's the advice of the ATAGI and AHPPC in the Commonwealth with the vaccination program. That's really critical. People had a 1 in 3 chance of dying in an aged care facility with an outbreak. If New South Wales had gone through its current outbreak without aged care residents being vaccinated, they would have had at least as many deaths as Victoria. So that's important. We absolutely have to get to a point where everyone is getting vaccinated now. We will do that as soon as supply allows. We are encouraging 1 million people to get vaccinated over the next 5 weeks. That's critically important. That will also help getting on top of this and protecting us from having substantial outbreaks in future and needing to have lockdowns. The Doherty modelling suggests that it becomes much, much less likely at 70% 2-dose coverage and virtually not required at 80% 2-dose coverage. We can get there.
Why the change to construction?
The messaging around COVID cases testing has been incredibly consistent for the last 18 months. We know what to do. We know what happened last year. We saw what's happening around the world and in Sydney as well. Most of these transmission are occurring in gatherings that are already illegal. How do you actually, from a public health point of view, how do you get the message across to those people who are blatantly and flagrantly disregarding the rules and who may not follow them?
Look, I think we're trying to understand what people's motivations might be. For some people, we'll never reach them, and we know that. All we can do is use the compliance of the public health response. But mostly I want to provide the clarity and consistency and and call out in the messaging. If you think the risk doesn't apply to you, you will be surprised. We've got primary close contacts stretching across the whole of metropolitan Melbourne, right down to the Mornington Peninsula, who maybe thought they weren't at risk, and to regional Victoria, where people have moved in and out. Not cases in regional Victoria, we've protected it, but primary close contacts stretching across the whole of metropolitan Melbourne. One of the reasons people say, oh, I will just see my family member, or I'll just jump over the fence and see a neighbour, is because they think the risk is not in their neighbourhood or doesn't apply to them as a population group or as an ethnic group or as a age group. And so I would just say, please understand that you will be surprised if you think the risk doesn't apply to you. You will be surprised if you think it's just a runny nose, it's mild, how could that be COVID? COVID puts people into hospital. Well, COVID puts people into ICU and it puts some people into hospital, but for other people it is just a scratchy throat and it is just a mild headache or just a runny nose. If you think that that doesn't apply to you and that that couldn't be COVID, you are wrong.
Last year we had the issue of a casualised workforce, people going to work because otherwise they wouldn't have been able to put food on the table. That problem we largely solved through isolation and testing payments. During this particular wave, there are people, and I know I'm repeating myself, but clearly breaching the rules because they don't care. How do we reach out to those people and how do we tighten rules around those particular groups of people? Is it a bit of a philosophical question?
It's a challenge. It is supported by both Commonwealth and state financial support. But again, I would say it's our collective responsibility to try and reinforce those messages as well. So if you as a family member are seeing that, if you as a neighbour, if you as a loved one, if you're getting that invitation to break the rules, to be invited somewhere, call it out and reinforce to those that you love and those that you know that the path here to success is the same path that we've taken every time. People doing the right thing in the vast majority of cases. But I'll let the Premier speak.
Can we ask one more for the...
I don't want to see, right? Let's be...
come from. Do we know for sure the cases we're getting now, are they linked to the Sydney removalists? And if not, is it likely they've come from Sydney?
The genomics is not diverse enough across Sydney outbreak and Victorian outbreak, which has come from Sydney. We know that much. It's not diverse enough for us to say it's linked to this part of the outbreak. What we do know is that the genomics for our current cases, our current outbreak, are very close to those that have come out of southwest Sydney. They are also close to some cases in our previous outbreak. So we can't tell. We have no link epidemiologically with our previous outbreak. And so the possibility remains, and maybe the probability remains, that it was out of southwest Sydney potentially.
So probably, but not certainly, a fresh
We can't
bit of
say
virus coming in?
with certainty that it was a fresh incursion.
Why the change to construction site limits now, when it's been proven that they can and they have been able to go ahead safely? Have there been spreads on construction sites that we're not aware of?
We've had those in construction in this outbreak who've been cases. We haven't seen transmission on construction sites, but we don't want to wait for it. Look, almost every other industry has been constrained to the fullest extent possible. Construction was one where there was some potential additional room to move, and so those further constraints, as difficult as they are, to reduce that risk even more. We can't wait for an outbreak in construction because of the significant numbers who are still involved in that. So it'll be pared back to the minimum that we can get to, and of course the critical and essential infrastructure projects that are continuing will continue.
Just back on the probably Jerome said quite unequivocally yesterday that he pretty much ruled out a link between the MCG removalists cluster and the current outbreaks. That wasn't the same as what you just said. What is the story? Was what Jerome said yesterday correct?
No, what he said yesterday was correct. It's not linked to the removalists genomically, but we had some cases in our last outbreak not linked to the removalists that it's got some genomic relationship to.
So it is similar to Coolaroo, but not to REL MCG?
Correct, correct.
Sure.
Again, no epidemiological link to Coolaroo whatsoever.
Existing childcare arrangements, will they be allowed to continue? And I know you made a point here about masks must not be removed to drink alcohol. Can you remove it to drink coffee or eat food?
Yeah, we're asking people to do the best that they possibly can, to apply common sense. You can exercise with one other person. We would strongly recommend that you're both wearing masks in the course of that exercise. Don't make it an opportunity to put your mask on your chin, coffee cup in hand, and spend half an hour arm in arm, because that's a transmission risk. So yes, you can, but please don't.
Existing childcare arrangements?
Oh, I can come back to you on the specifics.
Unchanged, and childcare and kindergarten can also continue unchanged?
It can continue.
Yep.
Just on kids, while we're on the topic, sorry. So calls to the Kids Helpline have surged 30% in the start of this year compared to last year. I understand you've got to close the playgrounds, but what are we doing to combat that issue and to ensure that, kids are,
Yeah, again, the choices here are awful and stark. We can't afford to have our kids out of school forever and locked in the homes forever. And so we have to defeat this. That's my public health advice. All the support of mental health agencies, and there's been significant government support, is to try and support kids through this as well. Schools in their online learning are also reaching out to kids to support them in the fullest way possible, not just to provide teaching opportunities, but to check in on them. And that's a really important thing as well. There's no escaping that this is not how, as human beings, we were designed to live, or that it's not profoundly challenging to our mental health. But getting out of it is the solution as much as anything.
What is the plan for schools? I understand at the moment we're in lockdown and they can't, and it won't be reconsidered that they would open during that. But going forward, a lot of schools are reporting that kids just simply don't have the motivation to remote learn anymore. Looking at year 11s and 12s in Melbourne now, it's specifically us who are struggling, who will fall behind on an education basis. What is the plan? Because there needs to be one, rather than this ongoing uncertainty for kids and teachers and parents.
There is a great desire to get kids back in school as soon as possible. That said, this outbreak had significant transmission events in schools. We are both working with Department of Education and Training to make schools as safe as possible. But in terms of that idea of certainty, the certainty is when we get to a point where we haven't got community exposure risk. So I can't tell you where we'll be exactly in 2 weeks. All I can say is that if everyone follows these rules and applies them as much as they possibly can, that gives us absolutely the best chance to get kids back in school. We will preferentially look to year 11 and 12s getting back because of their particular needs and the particular disparity now between metro and regional Victoria. But we have to do it when it's safe.
Is there a plan in place to vaccinate children?
Just on schools.